Hello, Ghana. You're welcome to this very special broadcast. And we're very happy to be meeting you again today. It's not a regular thing to always see me here at 12 o'clock on Mondays, but because the world is commemorating a very special day in the lives of the future of the world, we thought it wise to actually have this time to be able to educate us on what this medical condition is. A lot of people think this particular medical condition we're about to educate you on is spiritually backed, but science tells us that it is not the entire truth, if not like it's entirely not the truth at all. Today, I'm going to be having a doctor and some mothers as well as some children who are experiencing this condition. I'd like you to sit back, enjoy the program. At some point, I'm going to be opening the phone lines for you to be able to send in your comments or your contribution. You may have a child who is suffering from this condition. So we really want to have a good time with you, even as 1 hour rolls by. We know it to roll by very quickly, all right? And what am I talking about? Well, the name may be very difficult to pronounce. It took me some time to actually learn how to say it, but I'm trying my best, okay? We're talking about two conditions, medical conditions. One is spina bifida, and the other has got a pronunciation in American language, American English language, and the British. The Americans say it's hydrocephalus, and the British say it is hydrocephalus. So whichever way you pronounce it, you're still not wrong. I would like to acknowledge the person who has made me look this good. That's Afariwa Styles. Thank you so much. She's located beautifully on the Teshinungwa Road at the Rasta area. You know that place? Yeah, the container bus stop. That's where you find her. So if you get to container bus stop, look just to your right or to your left, depending on where you're coming from, you find her there. And she's into contemporary ladies and gents outfits. And my hair is beautifully put together by Awo's Hair, and you can also find her on Instagram and Facebook. I'll be going for a quick commercial break. When I return, I'll be introducing my guests as we all look forward to hear the stories they've got to share. Do not go away. You're welcome back to the special broadcast brought to you by ETV Ghana. My name is Eunice Tonya, and if you're just joining us, well, you're not late at all because I'm going to be introducing my guests right away. They will be doing it themselves, and they will tell us who they are and what it is they do in their various dispensations, okay? All right, so I'm going to be starting from the middle this time. I know it's always said ladies first, but this time he's a gentleman who is flanked by two ladies, so I'll start with him. Let's give him some kind of priority. So, gentlemen, please tell us what your name is and what you do.
So thanks for having me on the show. My name is Dixon Bando. I'm first of all a parent, just like Alpha and the other panelists. I am a senior resident in neurosurgery in Kwamfanochi Teaching Hospital, and I'll be handling the medical issues concerning spina bifida and hydrocephalus for this discussion.
Awesome. Okay, so I'm going to my right now. In Ghana, we usually start this way. So I'm starting with you. What's your name?
Okay, my name is Bernice Dobe. I'm a mother to the girl with a condition called spina bifida.
Okay. Yeah. And what's her name? She's smiling.
Her name is Eliezra Dobe.
Eliezra Dobe. Yes. Wow. Bernice and Eliezra, you're welcome, okay?
Thank you.
All right, so please, what's your name?
My name is Alpha Cruz Ejeyade, and that's my daughter, Pearl Ejey Echampon. She has a hydro and spina bifida.
Wow.
Yes.
Hey, how are you? You are amazing. You see, she's all smiles. Wow. Okay, we're going to have a good time today, okay? So do not feel shy, all right? Okay, good. So let's start. For those of us who really don't understand what it means to actually have this condition called spina bifida, could you tell us what it means to have this condition?
Right, so the reason why you and I and Alpha and Dogbe can walk normally is because our spines are well formed. Okay. If you have to feel your back, you realize that there are bones there covered very nicely by muscle and skin. Now what happened to Pearl and Juliesra is that when their spines were developing, it didn't develop fully, which by extension means that their ability to walk later on in life was affected. So really, when you talk about spina bifida, it simply means that your spine, rather than closing up as you and I would have, didn't close up fully.
Okay.
And the after effect is usually what we see in the children who come to us.
Okay, so when it is noticed that they've got this condition, is it after they are born or it can be detected whilst they are in the womb?
Right. So let's go back a few steps. Your spine develops in the first month of life. That is when your brain develops. When your spine begins to develop. One of the key things you need for spine development and brain development is folic acid. Now, what tends to happen is that if you do not have enough folic acid in your diet, that is when these problems come up. Now, for virtually half of our women who get pregnant, they don't know within the first month they are pregnant. And by the time they are conscious they are pregnant and they would want to take folic acid, the first month where most of the development happens will be well over. By which time it may be too late for them to benefit from folic acid with neural tube development, the growth of the brain and the spine. So that's what tends to happen. Now, when the woman is pregnant, if she does a scan mid-trimester, late trimester, it will be easy for us to pick up that she has spina bifida. Rather unfortunately, typical Ghanaian environment, women would want to wait till their 6th, 7th, or 8th months before they go to antenatal clinic, before they begin to do these scans. So by the time you realize they have this pathology, it's well into their pregnancy, and certain decisions the mother or the couple could have taken may very well delay.
Okay.
So yes, it can be detected in pregnancy, but that is when the mothers take the antenatal scans mid-trimester, late trimester.
Okay.
But that will even influence their mode of delivery of the babies, for instance.
Okay, wow. So far we understand that it's detected or it begins to take place within the first month when the baby is formed.
Right.
In other words, when they give us the folic acid to take, we are supposed to be taking it. And aside that, it means that when we want to begin to think around getting pregnant, we need to begin to take the folic acid.
Now
maybe like 3 months before the time?
That would be ideal.
Okay.
And that is why for countries, Ghana inclusive, there's a national folic acid supplementation program where for our staples, flour and so on, it's fortified with folic acid. So at the base minimum, every woman should have some folic acid in her diet. Now, if you are planning on getting pregnant, the best thing is to start folic acid, like you said, well before you decide to get pregnant. But if you look at a situation where we don't realize you are pregnant till well into the pregnancy, that becomes a challenge. But the idea would be for every woman in the reproductive age who plans on getting pregnant to start taking folic acid.
Excellent. All right, so let me come to you, Bernice. How was it when you were told that this was going to be happening to your child? How did you feel?
Okay, in my case, I gave birth to her before they saw it. So what they detected was, they said mild ventriculomegaly. That's the term they used.
That's a big name.
So I asked, and then they told me it means that the ventricles are mildly dilated, and that eventually they said it's hydro. So when the baby is born, either her head is going to be big. They talked a lot. Yeah. But when I was pregnant, actually they saw the hydro, but it was when I gave birth to her before the spinal bifida was shown.
Okay. So in your case, you've got both spinal bifida and hydro.
Yes.
Okay.
That's what was detected while she was in the womb.
So I was asking, how did you feel when you had to hear all these big names and like something like this was going to happen to your child?
Yeah. It wasn't easy for me.
Easy.
Yeah. In fact, the doctor gave me an option. It's either I terminate it or I give birth to the baby, and then after whatever happens, the one
just move with it.
Yes, please.
So is this your first pregnancy?
Yeah, this is my first pregnancy.
I can
my
understand the
first
reason
child.
why you just didn't want to go the other way. And she's such an adorable child.
Yeah.
Thank you so much for choosing life for her. Thank you. So I'll be coming back to you, Dr. again, before I come to Alpha, because she's mentioned another aspect of the conversation. We talked about spina bifida already, which has got to be a condition that affects the spine. She's mentioned that her daughter has got both situations, the spina bifida and hydrocephalus. So what is the situation with this hydrocephalus?
Right. So the brain is connected to the spine. Naturally, the brain is on top of your spine. Now, with the ventriculomegaly she mentioned, it simply means that there is a bit more water in your head that should normally be the case. I have water in my head, you have water in your head. Everybody has water in his or her head.
Okay.
But what happens in spina bifida is that because your spine didn't develop as it should have, it affects brain development as well. In some instances, the brain development will be quite okay, but if you have a very big spina bifida and you repair it, because that reservoir that the spina bifida used to serve its purpose has been closed, it may there be backup of water in the ventricles, and that is what causes hydrocephalus. Now, more often than not, those with spina bifida are likely to get hydrocephalus, but the reverse may not always hold. As in, those who have hydrocephalus may not necessarily get spina bifida. But more often than not, if you have a bifida, you are likely to get a hydrocephalus of varying degrees.
Okay.
Not everyone needs to be shunted. In her case, I'm sure it was a pretty mild, hydrocephalus. That is why she didn't get a shunt.
Okay.
But in other instances, if it's pretty big, the hydrocephalus, as in, we will need to place a shunt.
Okay. All right. So for those of us who really don't understand what a shunt is actually supposed to be like a tube that is used to drain the water from the brain, is it?
Well, so I think I got a bit ahead of myself. So what happens when you are discussing the hydrocephalus is that because there's so much water in your head, it places a lot of stress on the brain. The brain doesn't develop as it should. The best time for brain development is the first 2 years of life. The next best time is the first 5 years. Beyond that, not very much brain development happens. That means if you are born with a bit more water in your head than you should have, it places a lot of pressure on the brain itself, doesn't allow it to grow properly. So what we attempt to do is more like a plumbing job. Try to divert the course of the excess water in the head to a safe place where the body can reabsorb itself. And by doing that, we give the brain a chance to develop, which is why we do the process we call shunting. So just a very fancy term for diverting the excess water in the head to another part of the body where it can be absorbed safely.
Okay. So for people who don't really know how the hydrocephalus image looks like, sometimes you have some children who are born with enormous head sizes. That's what generally people think is, or people know to be hydrocephalus. But there are some other children who have the condition but do not have that kind of size. If you look at our beautiful Eliezer here, she doesn't have that kind of head, and she didn't even need to be shunted. There was no shunt.
Yeah, there was no
You
shunt.
see, so everybody's case is different. So whenever you hear that your child has gotten this situation or this condition, we don't think you should lose hope. You need to begin to come to doctors like the one we have here for them to give you medical advice. All right? Okay, so it's time for us to speak to you, Alpha. So how was it when you heard about yours? Did you go for ultrasound early enough for them to detect it? How did it go for you?
Yes, I believe within the first week of that I detected I was pregnant, so I started my antenatal.
Okay.
Yes, and then within that same time, I consistently did all my scans, and every time you go for review, that very hospital has these scans that you lie down every day. Doctors check you here and there, and then they make you go outside to do the other abnormality scan and so on and so forth. I like asking questions a lot, so I was told everything was perfectly well with my daughter. And I said, "Are you sure?" They said, "Yes, she's okay." And I was like, "Okay." So when it was time for me to go to birth, that was when I didn't give birth at the same hospital. I went to a different place to give birth, and then the doctor said, "Oh, Alpha, spina bifida." So I was like,
but didn't you have your red book, the red book where they record all those things?
Everything is I still have it up to now. I still have it.
Wow.
Yes, I do have it up to now.
So the red book did not indicate that there was
nothing.
Wow.
Nothing. And so I really was shocked. So I asked the doctor, what was it like? What's happening to my daughter? I said, she asked somebody turn the back of the child, and I saw this round thing at the back of the spine, like the upper part of the bottom. So I was like, what is this? And the leg, it affected the leg, so she had
so this
clapfoot.
Okay.
And so I was, what am I seeing? So I was really surprised, shocked, disappointed. I don't know what the word to use, but everything was running through my mind until they gave me an injection. I slept, and when I woke up, I saw the reality, like, this is my girl. And
wow.
So after, I was indeed very shocked.
You're devastated.
Yeah.
Okay, so when baby eventually came out and you saw her, let's talk about growing up. what did you notice about the child growing up? Was she able to crawl at the time she was supposed to crawl? Was she crying too much? Did you have to keep going to the hospital and back? What was the experience like when baby was born?
Yes, I'm a very determined person, trust me. When I gave birth to her, and then I read about everything, everything, joining platforms that I'm supposed to join worldwide, just to get information, to know if I am alone or I'm not alone. So that really kept me pushing, kept me going, and then I had to ask them to refer me to Confanoche. The doctors were like, if really she would die, I said, let me go. I want to go because you can't operate on my daughter here. So we were sent to Confanoche, and yeah, God being so good, I met good doctors, and they operated on my girl after a series of scans and MRI and so on and so forth. And so my daughter was okay, to the glory of God's name. We did one surgery and she was okay. So we were referred to, like, we were asked to go home after we had to work on the club foot. Okay, after the wound had healed, we worked on the club foot. So my life was in and out of hospital, like hospital appointments each and every week, like back to back. And because she had the club foot, it was like a whole other surgery will have to pop up. And so I tried to do all sometimes. In fact, I must be very honest, like it was really stressful. Like it will drain you. As a mother, you need time for yourself, you will not get it. Although she was not crying. And yes, in fact, doctors told me, oh, Alpha, she might not be able to sit, she might not be able to crawl, she might not be able to walk. And I was like, okay, let me take the child home. I will do the rest. So I read a lot, and then I kept pushing her. You can do it. Yes, you can. This is what I was always telling her. And then I made her sit at a time that she was not supposed to sit.
So practicing the sitting.
Exactly. So she would cry, I raised her a little, and then I put something that would distract her, and then I realized she was later enjoying the sitting. So she sat and continuously, and I realized I am getting there. So when it was time for her, and I read the month that she's supposed to crawl, because she's my second daughter, like she's my second child. And then I will crawl, and I will ask her to practice me. It's like we are just going hand in hand. I'll crawl and say, do it. I push one hand forward, one hand, one leg. So I will do that. And then she kept being motivated. And then it got to her walking time, and that one too was, in fact, it was a whole lot of things. But I kept going for my physio. I don't miss my appointment. I kept going for my physio. I'll come home and I'll turn myself into a physiotherapist. I'll do most. And gradually, she started doing it. When she was crawling a lot, she couldn't stand well. So we had something that would just hold the belly attached to the walker. So she will be able to position herself well. And that is how come we did it continuously. And then we had to leave her, and she started doing it by herself. Like she would go and come, she would go and come. She would fall, yes. And
every child falls when they try to walk.
Exactly, and people will say, oh, I said, no, don't say, oh, let her do it. She will do it. And she will say, what she doesn't like is you telling her, you cannot do it, or wait. She said, no, I can do it.
She's been raised to
Mommy
believe
said
that
I
she
can
can
do it. So that has really kept me moving. And then she pushes herself, so it also helps me to like help her. So like the whole thing is like, it's like a story, like a dream. Sometimes I wonder, how was I able to come this far?
Yeah, because I mean, when we look at her, I mean, it's so amazing. We'll be going for a quick commercial break. When we return, we get to find out from these mothers how financially draining this could be. And even you see all these gadgets that are here, are they kind of gadgets that you find here in Ghana, or do you need to import them? And doctor will also get to tell us if it's really spiritual. Have some people tried the spiritual means and probably got some miracles that he knows about? We'll find that out when we return, so do not go away. And you're welcome back to the show. Another mother has joined us right now. Eliezer has not gone away. She'll be returning, okay? So we need to also hear the story of another mother who we have here. and then we continue with what I said before we went on the break around how financially draining this situation is, and also what people are saying around the spiritual aspect and whether it's really worked for anyone so far. So you're welcome to the show.
Thank you.
What's your name, please?
Pachomidinde Afane Benedicta.
What friend Benedicta? Into honest, what friend then?
Benedict.
Okay. Wasn't to Benedict or then? Hey, honest was through. Hey, on the one night when you are what banner was smiling. So the mother's no yard. Thank you so much. Okay, Inti, what's going on with Benedict?
Me pacho, I can't say. Me wona me nyamuno me continental, but e bedroom rebi no na me yare kakra.
Okay.
Inti me nya 7 months no mokoye me surgery o komfa no che. But o manyi akra no. Inti me wo no na onya cat wo nachi. Na I talk say surgery na me koye ye no.
And maybe wa kan no.
Yeah, no na e kan no. Inti me start say me busa doctors no ensem, but no obia enyima no. Tomo ye say me fa no komfa no che. Na honom no na omo betimi aka de ato abofra ni na akire me nti ye de abofra no konfa no che, but before say me call ko hu say madese no kra na bebre so the same condition na me ba ne wo mu nti ma me hu say e bia na nye surgery na me koye ye no e na e ka me ba no na e bia ye bibi foforo nti me busa doctors no say e de na aye me ba no omo ma me ti ase say ye final bifida e na ato no nti in that case no e de o how bebrebe na e bebre abofra no nti ni na ne se menya odo e de ama akra na ya de a e wo ho nti omo ne me kasa nti 6 days time no e na omo fa no koye no surgery no e wo na chi nti before that omo ka kire me say ni ti nso ensuo ejiri e se omo hwe na omo ye ni ti nso but na me minister I want me one day to do I'm all I need to doctor say mama me na me ko boa me na ho boa esua e de akra ne beba na ya ye ni tin so surgery.
Okay.
Ya ko ye na ho boa no entimi enwia ko sise onya 1 year. Onya 1 year ne ko ye ni tin so surgery.
Okay. Into what one then ni tin no so no normal. No swapa che anybody na na. Okay, nti ehun no. And you know your first baby. Nti ewo na ehun the most what no. How not then? Like how did you feel? Say in the Africa no Ghana so bibia na ye de akade abosomfo aba na wode ayem me yankui tama me didi woni fie no almost na orhwe menyim last no me nante we na dem me bo ofum ntam de wa ayem bibi. Did you think that those things were happening? You felt they would be your bibi ana?
In fact me wo na me hu that condition dey nyame no no krema ba mu ebuye na me free say ne that so ni na asa because na me hu bi da na me share bi nso da na menti ho asem nso krada nti na adwe bebre ba mitiri mu me no bia nso a me kosusu ho a kire no sese na ato me ba no se na ato me ba nti me friend ba akọ na mitimi bo na mane se na me wo ye no ato me ba no nti ga ne nso de nyame mu ko hye mi kra bebre se hwe na mama ba mu engu na nyankopon enim de oye ena oye ma ne mana me nkosoma mani enko akra na ho ekosi se me kọ konfa no cha me ko hu madesi ni bi na me hu se ebi eya ade a ewo ho na nya me nko ana atomi.
And when you found out there you're not the only one, like ehu do nya one contain at least it gave you some assurance there. Okay, maybe no obeta Paul, right?
Yeah.
All right, so if you're watching us right now and your child is going through the same situation, we need you to know that you're not alone. It's actually happening to several people, and the children are being well taken care of at the hospitals, and they are living very good lives. You see baby Pearl here, you saw Eliezer, and we see Benedict, all, happy and giggling and really behaving actively as every baby will behave. So do not think that, some demon has possessed my child, so for that reason, I don't think I need this child anymore. I'm coming to the question I said I was going to be asking the doctor before we went to the commercial break. So, doctor, a lot of times you meet patients who come to you and you're telling them, oh, this is a situation. And in their minds, they already feel that it's not a medical situation because family members have told them that this is spiritual. So as you're giving your own diagnosis and trying to, tell them what to do, they already know they want to go somewhere. Have you had a situation? Hello, Benedict. Okay, baby Pearl, let's separate, okay, so that Benedict can also feel okay. Hey, Benedict likes attention. Benedict, you like attention. All right, so doctor, yes. All right, so doctor, tell us, have you had any kind of situation where you found that the patient was seeking spiritual options?
So rather unfortunately, that happens to be the rule, not the exception. Mothers like Alpha and I have known each other for like 3 years and plus, and he's one of the most determined mothers. If we had more mothers committed to their cause with their children, Ghana would be a very good place. Rather unfortunately, when they come and where these things are picked up on the prenatal scans, their first inclination is Ubina Yemi baby. It's rather unfortunate. And because we live in a very social environment, as soon as the babies come, then we have the quayside doctors come into the picture, offering alternative treatment solutions. So you may typically have, I quite remember about 2 years ago, I did one for a child. So I did it when the child was 2 years. The child had a hydrocephalus, from birth. Now he was informed that, the mother was informed in the spiritual realm, the child's head was a watermelon.
Okay.
And
watermelon.
So if he drank certain medications given to them by a native doctor, the head size will reduce.
Okay.
In another instance, the mother actually took the child to a herbalist who scarified, made some scars on the head and applied some herbs, all ostensibly to reduce the size of the head. But the truth of the situation is that, there's a place for herbal medicine in contemporary practice, no two ways about that. But for some of these pathologies which are structural, the only way of managing them is through surgery. There really is no drug or no spiritual sacrifice or no herbal poultice that will reduce the size of a child's head if he has hydrocephalus. Neither would it help cure the spine if he has a spinal bifida. And rather unfortunately, for these children, time is literally of the essence. The earlier we do the intervention, the better the outcomes. If you quite recall, I said that for the first 2 years of life, that is the most critical part for brain development. So you can imagine that I am born with, say, hydrocephalus. I have a normal head size. My brain is as it should be. But because the volume of water in my brain is outpacing my brain growth, it's going to press on it and my brain wouldn't develop well. That means if I'm to have this surgery done within the first 3 months of life, my outcomes will be much better than if I was taken to a herbalist who says I have a watermelon head in the spiritual realm, I need to have herbal poultices and so on. The outcomes will be much, much different. So rather unfortunately, we have quite a number of patients who, when they are given this information, would rather opt for alternative treatment. And by the time they realize that isn't helping, in terms of mental growth and function, it may be a bit too late to help them. But then the good news is that with the help of mothers like Alpha, we are having more support groups that are actively educating women whose children have spinal bifida and hydrocephalus about the condition, and letting them appreciate the fact that with the appropriate medical help, the child can live a virtually normal life, And I keep on telling parents that the best doctors to manage these ones really are the parents. Not even the trained ones. The parents are the best doctors, because the parents will have to make a decision to send the child to the hospital. The parents have to make a decision to accept our treatment. The parents may have to make a decision for the follow-up care we give them. In the case of spinal bifida, beyond the problems with the legs, they have a problem peeing, they have a problem pooping, and that predisposes them to a lot of infections. So if you do not have a parent, if you don't have a mother or caregiver who is actively involved, actively conscious about the child's condition, and actively engaging with other mothers to form a support system, that will promote, treatment for the child, it really becomes a concern. It really becomes a challenge giving the best of care for these children.
Wow. So coming over to Alpha, he's mentioned that people like you have really been giving a lot of support to other mothers. Thank you so much. All right. So were you working for someone when baby Pearl was born? Because I'm looking at the aspect where you mentioned that you had to be going in and out of the hospital. So if you're an employee, how do you combine it? How was it?
Yes, I did mention I'm a travel consultant, so I was working, yes, for someone, and that was when I took the seat. And after birth, I realized I cannot work for the person again. So it's either, yes, I was equally given an option at the hospital, but I chose the girl. I chose her.
You chose life.
And she's
Thank
so beautiful for me to let her go. So I quit, and then I started working from home, trying to see if I could establish my own. So this is how, and this is how it all started. And so you have to go through that hassle of working at the same time, taking your child for hospital appointments, which is very, very important. Yes.
So being an employee is something that is really going to be a challenge. So
Indeed.
that's why we're trying to work out if you could do your own business.
Exactly.
But here's the case, almost every money you already have in your savings has been spent in doing the surgery and seeing to the welfare of the child. So how were you able to gather the finances that you needed? Were you having the support of friends or family, her daddy? I mean, how? Because we need people to understand that mothers who go through this actually need support. So everyone needs to come on board to help them. How were you able to access your finances?
Yes, in fact, this issue with spinal bifida and hydro, it has to do with the whole community. Like, nobody can handle it alone. Nobody. Actually, I am still receiving support from my family, my friends, and my husband.
Wow.
My work cannot do a thing.
Don't go too far. We want you to say thank you to your husband.
Honey, I am so grateful. Thank you so much.
Yeah.
May God bless you.
God bless you. And then other friends, thank you so much. We give priority to husband because he's the one that has to really deal with the situation.
Indeed,
he has to deal with it. So that's why we've given him priority.
Thank you.
All right.
Yes.
So I'm coming back to you, my dear Benedicta. Inti actually baby na ehu mosia nyamaro kono no. Ehu na ehu there you are not alone because there were other mothers who were also going through it. Inti not then what were family members telling you? What share na at Erico Hospital they bia ndesika echna day. What was it like? Were they telling you were wasting your time or Jai Hospital no call na call prepare obi oba yard na ma na Jessica ya SSA? Did you have art councils like that?
Well, me patch me busy phone dear. Omunim dear shada to me bano. Pa nti my friend ba korono kwa ne nim dear ato me bano. Ti ono so dear o shame crime said there be a menko so. Hospital bia SM dia kra never could be obenya na ya resebia no. Memfa no enko.
Now how did the family not know? Not one best rawa.
Me mother me father nko na omunim but omo so no kra bi ni eho no musa na omo betimi aboa but omo so omo hye me nkran say obeye ebeye me ma me nko akra na ho ebeye na even though no omo say hye me nkran say me fa hye me tirim say like nye obi a ne basasi so a onya no 100%. Ebi e sabi omo ye disable bi nso ehuru ade nti me fa hye me tirim esa na yana mama no ha me pii say makowo eba bia sabi ontimi enante because no obi an basasi so a otimi nante nti sometimes omo de empanifo ni bi kra eye mfato ho etre me say obi onuma o ye adwuma wo bank o ye disable obi tra de o ye disable obi ye say nti sometimes omo kasa answer me kire me yana echichire me re good that activities me ba no so betimi aye bibi but on kadem
nti so otumu kasa
Pachafina or try so
no because until when I'm feeling says here
Pacho 1 year 3 months.
Wow. Into what's the story we are? Is he crawling?
And Pacho madam I found nothing or church.
Oh no, church is most everyone no way to my crawling and more the year baby Pearl no. Please, how old is Pearl now?
Pearl is 4 years.
Hey, you look so big, bigger than even 4 years. Wow.
So one of the concerns about mothers and parents in general when it comes to hydrocephalus and spina bifida is that will my child be able to do the things her contemporaries are doing? Will she sit at 6 months? Will she walk a 1 year and so on? And the answer is yes. Again, it depends on how soon you present the child for an intervention. Like we mentioned, the first 2 years are the key, time frames for your child. So earlier we get these interventions, the better the outcomes will be.
Great.
I'm in church with, she should be about 25 years and started working. She had spinal bifida hydrocephalus. The surgery was done when she was a baby. She's a graduate from a university. She's working now.
Wow.
Yes. So once the interventions are done early, the child virtually has a near normal life without any intellectual disability.
Awesome.
So time really is of the essence.
There's
Exactly.
like a lot of chances for your child to just be normal, okay? And live a very, very, very normal life. We'll go for our final commercial break. When we return, we'll open the phone lines and hear from you if you've got something you'd like to share with the mothers here or even the doctor. Do not go away. You're welcome back to this special edition of the commemoration of this medical condition, spina bifida and hydrocephalus. So we've got a doctor here and we've got mothers who have amazing children who are managing the situation, and it looks really good. So do not hide your child at home or maybe feel embarrassed to bring the child out because you feel that there's something really wrong with my child and I don't want the child to mix up. You are not alone. So feel free to take the child to the hospital. However, when we're on the break, doctor mentioned that now treatment centers have become regional. So we would like him to let us know exactly where mothers can go across the region to be able to access help. Doctor, please take it away.
With the treatment of hydrocephalus and spina bifida, it is done in a multimodal environment. We have neurosurgeons joining in, pediatric surgeons, urologists, physiotherapists, and so on. Currently, there are treatment centers across the country. In Greater Accra, Kolebu, headed by Dr. Patrick Banker. That's our main treatment center. There is one at Ridge Hospital, Dr. Vuado. There's one at EGMC, Dr. Totime.
Okay.
And then 37 Military Hospital, Lieutenant Colonel Lapierre and his team.
Okay.
So those are the 4 for Greater Accra. For Ashanti, Komfanochi is the main treatment center. And for Central Region, Dr. Ajin Mensah in Cape Coast manages those ones. For Tamale, Dr. Adam Abbas, he manages the Tamale Center. So I'm happy to say that in Komfanochi, we identified finances as a major barrier to children getting access to care. So what we did was we partnered with Cure International, who have provided us with free shunts. So for virtually every child with spina bifida and hydrocephalus who needs surgery, NHIS pays for the cost of the spina bifida surgery, and Cure International provides a free shunt. Okay. So the take-home message is finances should not be a barrier to accessing healthcare for these children.
Wow. Thank you so much, Cure International, for seeing to, at least the financial burden that a lot of mothers are having to face because of this condition. Thank you so much. So, well, we are hoping that this connection gets to go across the entire country so that much more mothers will also be eased of the burden that comes financially around this. Okay, so talking about these gadgets, so the phone lines are open, okay? If you want to call or share something, please feel free to do the call right away. We are seeing, what is this called? What they walk with?
It's a walker.
It's a walker.
Yes.
So, like, you don't have a special name for it. You just go to any shop and then you say you want a walker?
No.
Or they have to build it for you?
Specifically for, I see, I've not seen much here in Ghana. There's my daughter's own and few of them. But mostly, I see children with living with spina bifida. They use this particular walkers.
Okay, so you have to import it, or is it somewhere in the hospital where you can buy it from? How do you find it?
I haven't come across some in any hospital, but this was brought from outside.
This was brought from outside. Wow. Okay, so what about the mothers that you've been educating? Have they told you how they got theirs, or most of them also imported it?
Unfortunately, none of them have one. They don't.
They don't have it. So how do they support their children to
So
we're
using the locally made.
Okay.
Yeah, the locally made one. This, I have removed that. There's a particular metal here. I took it off because my daughter was able to position herself well. Yes, that thing was there with a belt.
Okay.
To hold her, to position her, let her stand straight. But I took it off after she
got the balance
exactly,
you needed.
Yeah.
Amazing. Okay, so let's talk about the risk factors. You've already advised mothers who want to, have a baby to begin to take folic acid way before pregnancy takes place so that they could avert things like this. But what are the other risk factors? Sometimes you hear people say, the woman was too old. That's why she had this kind of child. The mother was a teenager. Like, nobody really understands what the risk factors are. What are they?
So like you rightly said, nobody really understands what the risk factors are.
Okay.
Because we operated on the child about 3 months ago, a set of twins. One baby had it, the other baby didn't have it. Now the biggest association is folic acid deficiency, but beyond that, some children are born with what we call syndromes. So they may be born with a heart problem, a kidney problem, and so on, and may have spinal bifida and hydrocephalus as part of the spectrum. Now, for hydrocephalus in particular, some children develop it after they are born. So for newborns who have infections, it is likely, brain infections at that, it is likely for them to get hydrocephalus at a point. For the preterm babies who are born and have a traumatic birth, bleed in the brain, it is possible for them to also get, hydrocephalus. But by and large, it's a bit difficult to say that you are going to get hydrocephalus, you won't get spinal bifida. It's very difficult to tell. But what we have control over is the folic acid policy. And that is why, as a nation, we have instituted the folic acid supplementation policy. And it's really been encouraged globally. Take folic acid before you get pregnant, fortify your foods with folic acid as a national policy.
Amazing. Anyway, our time is fast spent, and I was looking at maybe someone calling in to ask a medical question. That's why I had to keep the doctor here. But it seems every medical question you had in your minds have been addressed properly. Thank you so much, doctor. It goes a long way to say that people have really understood whatever education that we are giving out to them. So we'll be inviting our third mother to come over. Women, we love to sing a lot, and I want to know what songs you sing for your children to make them calm down. What do you do? I need to see that thing just in a few minutes before we just wrap it up, okay? All right, so please, can we have her come? Yeah. Tell us. What do you do? How about you, man? How the man I mean here? Say, mothers didn't hear any voice, but yet to I am gonna pay, and you know yet to know. What do you do to calm the baby down?
Sometimes we'll swan, no to want me beg a cow. One a bow, war, tintesio, nami money be.
Wow.
Me beg a cow, me money that my brain home.
Oh, you see, he's clapping. He can relate to it. So what do you do with Eliezer when you want her to be calm? She's always calm. Excellent. She'll be the one singing. Okay, Eliezer, would you sing one of your songs for us? We want to hear you sing the song. Which one do you want to sing? Baba Black Sheep? Okay, sing that one for me. Benedict is helping. One for the day, one for the little violins down the lane. Yeah! Awesome. All right. Pearl, what would you do for us? C, D. Yes. Wow. Q, R, S, T, U, V, X, Y, and Z. Good. A, B, C. Next time, would you sing with? Oh, I'll sing with you over and over and over again, okay? Mommy already told us that what she does to calm you down or to get you to do things is so that you can do it. And know it today that you can do it, okay? You are not different from any other child. You are blessed and you're highly favored. Eliezer, keep being calm and keep enjoying your Baba Black Sheep songs. The next time you come, you'll be singing another song for me. All right? Benedict, whoa, for you, dear, you are all weather. All right, so please, let me just take, just within a few seconds, what would you advise any mother who is watching us right now and has a child who is suffering this condition? Let me start with you, Alpha.
Okay, I would like to say that we mothers, we're going through a lot, yeah, but then we are not alone.
Okay.
I always encourage mothers, please bring your kids out. Then we can empower ourselves, motivate ourselves, because we take motivation from each other. And no two butterflies are the same. You see spina bifida, and then this one has a different spec, this one has a different spec. So we come together, we learn from each other, we motivate each other, and I believe this world will be a better place.
Nice. All right, so tell us, what would you advise any mother who is watching right now?
Yeah, I would like to advise all the mothers out there to be strong for the children.
Okay.
They need us emotionally, physically, they need us. So we have to be there for them.
All right. Inti ad nebe katre mami bia orishe hensesi a neba bia owo hydrocephalus ana spina bifida.
Nina ne say they say omuchre odo sonko edema emofra no omuhia odo nko ane ade a obetime de ama omo.
Oh, nice. Well, this is where we call it a wrap. It's been an interesting day, and do not stop sending in your questions. If you have a question that wasn't addressed, maybe because you didn't send it in early, no worries. We'll always send it through to the doctor for him to give us the response, okay? So please keep it coming. So until we meet again on the next special edition, do enjoy the rest of our interesting lineup for you. Bye-bye.